We're so strongly trying to fight stigma, and everything we do, it's like, let's bring it out into the open, and talk about it. It's a matter of life and death.
It's a battle 53 million Americans face every day, some form of mental illness. In fact, demand for mental health and substance use treatment services was greatly impacted by the pandemic. Hospitals have been overwhelmed, making in-person care harder to access. So how do we help those who need it? That's coming up this morning on the Morning Medical Update. Hey, good morning to all of you. Glad you're with us. It's Tuesday, May 10th. Thank you for joining us here on Facebook, YouTube, and on Twitter. Coming up today, the actions of a popular cartoon character could help keep your mind intact. We'll take a bite out of this latest study. In just 15 minutes or so, Dr. Dana Hawkinson will join us with the COVID count. But first, it is a leading cause of death among some age groups in the United States. Every 11 minutes, someone takes their own life. So how do we help stop suicide among those with mental illness? Get your questions sent in to us, please. Go to YouTube, Facebook, Twitter, or you can email us at the Medical News Network. You can find links to those right there on your screen. According to the CDC, more than 12 million Americans have at least thought about suicide. It's estimated 1 in 10 in the metro area has a serious mental illness. Meet one family now who is turning the pain of losing their son to suicide into a way to reach and save others.
Smart, athletic, handsome, but very kind as well.
Kelly Specht describes her son Carl, who loved all things sports. But when he went off to college, without any warning, he had a psychotic break.
His mind was a steel trap pretty much, and we couldn't get through to him. He wasn't the Carl that we've always known.
Carl, like so many young people suffering from mental illness, turned to suicide as the answer.
It is the second largest cause of death for children ages 10 to 24, only behind unintentional injury. And so it is happening more.
Emily Snow is the director of behavioral and mental health at the University of Kansas Health System Miralac campus. Here, she helps teens suffering from mental illness and calls suicide an epidemic, especially in Johnson County.
The state of Kansas is 8th among the United States for suicide.
Snow says the stress of returning to school can be a trigger.
I think that kids feel a lot more pressure to be successful in school, to be successful in extracurricular activities, and to be successful in sports.
And social media doesn't help.
Because they know what's happening with all of their peers, the pressure is just higher, and there's more of a demand for success.
Carl had tons of friends and family support, but also suffered from manic depression. He ultimately took his life.
As a mother, you do everything your whole life for your child to make sure they're okay. And so to lose a child is just, pretty much the worst thing that could happen.
Kelly and her family are turning tragedy into cause, Carl's cause, generating money from golf tournaments and fundraisers to support mental health facilities like Miralac.
It's a serious epidemic. It's happening both with kids and adults, and we need to address it. And we are working really hard to do so here at this campus.
We're so strongly trying to fight stigma, and everything we do, it's like, let's bring it out into the open, and talk about it. It's a matter of life and death.
And that's what we're going to do here this morning. Carl's parents, Bob and Kelly Specht, join us now. Good morning to both of you. Thank you so much for being with us. We're also joined here in studio with Clinical Director of Psychology Services at our Strawberry Hill campus, Dr. Greg Nawalnik, and Behavioral Health Navigator, Dimitri Troutwine. Good morning to you two. Thanks for being here in studio with us. Bob and Kelly, again, thank you for being with us. Thank you for sharing Carl's story with us and with the world. No question, you are saving lives. I want to start with you because, like so many parents, they are always looking for signs and ways to reach their children. What are some of your earliest memories that something wasn't right with Carl?
Well, with Carl growing up, he never had any signs really. He didn't suffer from depression or any issues whatsoever. It wasn't until he went away to college and in his early 20s, and then that's when we learned that that's very common of a time of onset for young adults is in their early 20s. And a lot of times when they're away from home and away from family. So,
well, and I want to, Greg, Dr. Nawal, this is something we've been seeing in the news quite a bit lately. college athletes, young kids in their early 20s taking their own life. When you look at them and you think they've got the world by the tail, just starting out. What do you make of that? This recent, I feel like we say 2 or 3, that seems like 2 or 3 too many.
I mean, absolutely. And what it really comes down to is the fact that you can't see this from the outside. And this is an internal, personal battle that people wage every moment of every day. And by the time that they get to the point that they actually are having the suicidal thoughts and even making plan and trying to carry it out, this has been going on and likely secret for so long because, like Kelly talks about, the stigma around discussing mental health and this idea that especially the higher profile and the higher status that you have, there's almost an expectation that you should just have it all together. And so that compounds the stress and the shame and the guilt around, it's not a personal problem. It's not a shortcoming of any kind. This is a chemical imbalance. These are situational things, pressures, different things that have come on that are, if not treated, it's almost impossible. They will eventually in time overwhelm you, and it's crippling.
And it's wrapped in this nice package of this a young adult going off and doing great things. And you're right, it's very confusing because it's what we don't see. Yeah. I want to ask the Spechts, what type of mental illness did Carl have? I mean, what did they ever diagnose him with something? Was he presented with treatments?
Yeah. When he had his first episode, we did get him in to see somebody, and the diagnosis was bipolar at that time. And one thing I will say is, as a parent looking back at that now, it's something you don't want to believe, but you need to take it very serious because with his first incident, we didn't want to believe that, and so his diagnosis was bipolar. Yes.
You all created Carl's Cause, turning this horrific event in your life into a way to reach other people. Tell people about Carl's Cause, because we're going to talk about that throughout the show this morning.
Yeah, well, thank you. So, obviously after our loss, we really were all trying to figure out how we would go forward in life. And we knew we had to do something. And actually it was Bob a few weeks after Carl passed away that he said, we've got to bring this awareness more to like a stadium level, like bring it to out into the open on a big scale. And that's kind of when we decided that was going to be our mission. And so we started Carl's Cause. We kind of have 3 main things. We want to create awareness, we want to combat the stigma, and we also want to connect resources, which is what we do with the University of Kansas Health System.
And I want to mention that the Spechts and Dimitri and Dr. Nawalnik all know each other, and I know you all work closely together to help others. Dr. Nawalnik and Dimitri, we talk about silver linings, I guess, of COVID, and as Kelly said, bringing this to kind of a stadium level and the awareness. But how did COVID help? What was the good and the bad when it came to COVID, as far as bringing mental health awareness about all of us to the forefront?
Well, I think the way that it helped in terms of bringing it out was that this was finally an opportunity where everybody could acknowledge, hey, this doesn't look the way it used to. Things are different. We're all having struggles adjusting. And so with an event such as like September 11th, COVID, where the entire populace is affected by whatever occurs, that's where you're allowed essentially to have this conversation. It now is able to be brought up to the surface because it's touching everyone. And so that was kind of the positive of it. The negative is the impact that we saw from it, and the fact that providers, and Dimitri can certainly talk about it, that we're still seeing the impact. And I think that now as we start to come out from the blunt force of the pandemic, just like a soldier on the front line, you continue your objective while you're on the front line, but it's once you pull back into a safe place, that's where the cracks start to form and show, and where we start to see kind of some sign that things didn't exactly make it through the way we hoped.
Dimitri, what were you noticing? What have you noticed during COVID personally? What kind of experiences were you having with people you were trying to help?
Well, what I've discovered is people they're fed up and they're tired of feeling tired, and they're people are reaching out and asking for help and asking for resources. And I feel that telehealth has really been a good thing from COVID, because it helps us connect with people who are in need that can't get out. And I also think that with telehealth, it helps people. At first, they're kind of skittish about it, but it's after they figure out, oh, okay, there is somebody there that cares, that it opens the door to normalize these conversations.
Bob and Kelly, how did the pandemic force you to shift the way you helped other folks here in the community?
Yes. Well, we weren't able to have in 2020, our second big annual fundraiser, which we had done in 2019. But we do a golf tournament, and so we were able to still do that. We also did a virtual fundraiser last May, and we're going to kind of do the same thing this May, more of an online. And we have a great support community.
Yeah, we have a really good network of friends that we can reach out to through our link through Network for Good is what we use. But anyway, through that, we're able to still contact people, and it's amazing to me what's happened over the last, well, it's almost 5 years now in June. But the people that reach out to us now, actually, what can we do? What are you guys doing? How can we help? And I think the media is part of that as well. You see it a lot more in the media than you used to. Maybe we're more cognizant of that, but it just seems like through the pandemic, it really hasn't slowed our desire or our support to keep helping people any way we can.
Well, the donations that you raise go to various places, and one of them has been to us, and it allowed us to bring someone like Dimitri to our health system to help people going through this navigate through the process. I think that's a really heavy load, Dr. Nawalnik, to, we have navigators when it comes to cancer treatment, and they kind of help you and guide you through the door and help you understand what to expect. And up until now, you're just expected to come knocking on the door and ask for mental health assistance, and it can be really overwhelming. So we're glad you're here. We thank the Spechts and Carl's Cause for helping continue to help other people. So Dimitri, tell me what you do specifically to help guide patients.
So specifically, whenever we began the idea of Carl's Cause, there's nursing navigators to support cancer patients that are struggling. And so the idea from the psychiatric team was to come up with, how can we support those who are struggling with mental health? And the idea was given to have a navigator or a bridge support, and that's what I am. So initially, whenever patients discharge from the health system, from inpatient psych, or are struggling with depression or any clinical symptoms of bipolar or whatnot on main campus and are wanting additional support, I am here as a bridge to help them with basic therapy, case management, crisis management, connecting them to resources, and I support them and their families as they transition from inpatient to outpatient. And I will continue to meet with them and their support systems on a weekly basis, and then until we can get them firmly planted into outpatient resources. Because that's what we're finding is people fall through the cracks, and we don't want that to happen to anybody.
So she answered it, but how impactful is this, and crucial is it to be able to care for our patients the whole way through?
I mean, it's huge, and partnering with Carl's Cause has been such a great opportunity for us. Initially it started off, we connected. They referenced their large event that they do, which they haven't been able to do because of the pandemic, but it was amazing to see, and I think it's a testament to the Spechts themselves and their story and just who they are as people. That they filled, St. Thomas Aquinas, their hall with supporters and everybody just wanting to give. How can they help? What can they do? And that hasn't waned. Throughout the entire pandemic, those people turn out every single event they have, and it's because of how relatable they are. And when we look at the navigator position, Initially, Carl's Cause supported us by purchasing all the exercise equipment that we have at our Strawberry Hill campus, which is amazing, and it's because we know how important that exercise is to wellness. And then after that, they're like, all right, what next? What do we do next? And so that's kind of always their question is like, all right, what now? What else do you need? What else can we do? And so we worked with them and collaborated and discovered that, what we could try to do was figure out how to help educate and support families and the patients who were maybe first time into a psychiatric facility and didn't know. I mean, it's a whole language and a whole education that if you're someplace that has really great case management, maybe you get some of that while the patient's there, but once they discharge, it's like you're in this little nest and then suddenly you're just kind of dropped out with an appointment and a prescription and said, best of luck. And I think that that's what happens all too often, especially with mental health. It's something that people just want to try to, plug their ears. It didn't happen. That was an aberration. It's not really our lives. Let's just put that on the shelf. And so it's important to track that patient after discharge, stay in touch, continue to answer questions for the family, and really connect them to the resources so that they're able to continue and have that nice bridge and transition back to the community. Inpatient is like the emergency response for acute crisis. But the real work is done in outpatient on a more chronic and continual, persistent basis.
The work afterwards, after they leave you.
Absolutely.
Such an important conversation. I want to take a quick break because we're going to turn and send it over to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, to join us with our COVID count this morning. Good morning.
Yeah, hi.
Hi.
Yeah. COVID count active infections down to 3 active infections. So none in the ICU, none on the ventilator, 14 that recovery period again. We know that overall trends are inching up slightly, both in cases, but again, there's probably a lot of cases we don't know about, but hospitalizations inching up only slightly. We know that in some of the other countries, they've had surges. Those hospitalizations from those surges did not reach that Delta Omicron surge number that we saw in November, December, January, February. So I think that's all good news, and we will continue to hope that people can have immunity, mostly by vaccination, of course, that's the safest. But also, if you do get symptoms, please go get tested early. And we know that there is that oral antiviral out there that also does really good at reducing your risk of coming to the hospital and, of course, going to the ICU. So,
a couple things I want to ask you about. The Biden administration talking about the mass amount of Americans that could be infected during a surge coming in the fall. So we're already talking about fall. We're not even talking about this June wave. What are your thoughts, or what are you hearing?
Yeah, I mean, that is a large number. That's almost a third of the American population. So again, I'm not as concerned about infections. When you have no restrictions whatsoever, nobody masking, you have in the fall, it's going to be getting colder. You're going to be having people get together more indoors. It's almost expected that there probably will be a surge in infections. How much of those infections will we know? Obviously, people can do home testing. We know that other testing sites funded by cities and states and other health departments are probably going away. So that's important to understand. But what do we care about most? And we care about most about hospitalization, severe disease, and death. And so I think it continues to be incumbent upon every individual to make sure that their family, their bubble is most protected. And the way to do that is by getting vaccinated, being up to date with your vaccination. And then again, if you do have symptoms, get tested early. And right now we have that very good antiviral Paxlovid, which is still working very well to help reduce your risk of hospitalization. Do all those things, and I think you will continue to be safe throughout that time.
So as people their concern about COVID continues to wane, Kansas is now providing free COVID-19 testing for summer camps this summer. How important is that going to be as far as we talk about a wave coming, a surge in the fall? Could that help?
Yeah, I think it's going to be most important for those children that are not able to be vaccinated, although I'm not sure how many children 5 and under are going to be going to those summer camps. So it'll be important for that, but also for those children maybe that might be going home to more people with at-risk people in the household or around them. Overall, again, the best thing to do is continue to vaccinate your child. We know that children overall don't have the highest rates of severity that we do see in those older populations, but they can still get severe disease. They can still go to the hospital. They can still die. We know they can get long COVID as well. So helping reduce your risk or reducing your child's risk by getting vaccinated is going to be, again, the best measure moving forward. And especially if they aren't vaccinated, it's always a good time to do the right thing. Getting them vaccinated, especially if you know they are going to be going to summer camp and are going to be around a lot of other people.
Good advice.
Yeah.
Thanks, Hawk. We'll see you in a bit. We are back now with Bob and Kelly Specht. They lost their son, Carl, to suicide. We're going to be talking with them this morning. Also with us is Dr. Greg Nowalnik, clinical psychologist with the health system, and also Dimitri Troutwine, behavioral health navigator with the health system at our Strawberry Hill campus. I want to ask Bob and Kelly, I'm going to have you start. I want to ask everyone on our panel today, but it's such a big question. How do we change the stigma? Where do we begin?
I think just talking about it, doing exactly what we're doing right here. You've been great about, continuing the conversation. Our goal to bring it to the stadium level actually happened last summer, and we were so excited to see that. And I think if we can get more of the major sporting, events to just have a message every game about mental wellness. It just got to be normalize that conversation, I think, to help.
Yeah, I think, excuse me, Kelly, but I think the media will be a big player in that. And the more the media is out there and talking about it, we see some pretty big figures that have been taking their lives, and it's okay to talk about it. I mean, we were adamant about when we lost Carl that we wanted people to know that it's okay to talk about it, and I think that helps people that are struggling maybe eliminate that stigma a little bit. That it should be common talk about if you're struggling, and I think people that are struggling then will reach out for help. The more they see it, and like I said, I'll go back to media. I think it's a big player in this, and the more they do things like what we're doing this morning, and TV, billboards, whatever, put it out there, because people internalize it and don't want to talk about it, and that's where the struggle begins.
Such an important topic to keep talking about. And, when we talk about the stigma, I know, Dr. Walnick, I'll bring you in here because we talk about when a celebrity passes away from suicide. Naomi Judd just took her own life, and I know her daughter said they didn't lose their mom to suicide. They lost her to mental health, took our mother. And do you think it helps, I guess, when something like that happens and everybody's reading it or thumbing through and looking at it on Facebook and social media, and we go, okay, here's somebody, again, another celebrity. You think they have it all. They've got the money and the fame and the beauty, and they couldn't get there. Does that help? Does it help? Does it hurt?
I mean, it helps in terms of normalizing the struggle that a lot of other people are going through at that exact moment. And so, I think that we have such a divide between, and it's unfortunate, between physical health and mental health. And, a broken leg, I'm sure there's probably evidence that it has killed someone at some point somehow, but it's very rare. Whereas mental health, it takes, the numbers are staggering, how many people fall victim to not staying on top and not engaging and not trying to seek the care. And if you think about every 6 months, you're supposed to go to the dentist for your teeth that you're chewing with right now. It's like preventative care is just kind of the norm. But with mental health, that affects literally every single aspect of your life. We're like, no, I'm good. I don't have time for that. And so this is how important this conversation is to have, and that we have to start looking at being proactive and having preventative care around the mental health aspect, not just dental and every other type of regular checkup. And I know the Spechts actually wanted to comment on the Judd situation, because it does resonate when this type of thing happens.
When you hear things like that, Kelly, what goes through your mind?
Yeah, well, the first thing when the media announced it and they said that she died of a mental illness or mental health, I knew too what had happened, but I was so grateful the way they put it out there, because it is a life and death situation, mental illness is, and we need to look at it that way instead of splashing it all over the media as so looking at how she died. That doesn't matter the reason of what happened. Also, I think that the video clips they've played of some of her earlier interviews talking about that this isn't a character flaw, this is a real illness, and it's our brain health really what it comes down to. It's having your brain and to stay healthy your whole life.
It's something, I'm glad you brought that up, Kelly, because something that stood out for me when Naomi Judd was talking about it, she said, I was listed as, I guess she was resistant to medication. I mean, how scary is that? Here's somebody seeking the help and trying to get the help, and now they're resistant. And now she said she was diagnosed in the end with a severe mental illness. What do you make of that, Dimitri? And how frustrating is that to somebody to get the help and then realize nothing's working? What do they do next?
Well, unfortunately, that's very common, and sometimes it's kind of defeating. And so, even more, why I think it's important to normalize this at a very young age. Unfortunately, there are children as young as 4, 5, and 6 that are seen to have predisposed symptoms of mental illness, and it's like, how do we get ahead of this? That when you start, I think it starts with education, in the schools, and education with parents, and it's okay, versus it being a big scary thing, to understand it, embrace it, and how can we maneuver and work around this together.
Talking about mental health, it's about not just trying to have the positive emotions. It's not about the positive. It's about trying to overcome those tough times. How true is that? It seems easier said than done, Dr. Nowalnik, but how do we tackle that?
Well, I think that the first part is actually being able to have the conversations, being able to acknowledge it, and being able to own and say, like, I hurt, I'm not okay, I'm in a struggle, I'm not at my best right now. Because the reality is that imagine that you're feeling terrible and you're trying to keep up appearances. It magnifies it tenfold. I mean, the feeling, because you feel like a fraud, you feel like you're living in someone else's body, and that you're living this false life that when you come home and everybody else is gone, you just buckle, and it's worse than it would ordinarily be. So it's important to be able, because nobody can validate or support you if they don't know. And so, you might have the most loving, supportive, caring support system around you, but if they don't know because you're masking it and trying to keep it a secret, there's nothing they can do. And unfortunately, depression is a self-feeding animal. We've talked about it a lot of times, that it becomes this set of lenses through which you view everything, and it can diminish the motives and the caring from your support system. It will magnify every shortcoming, mistake, accident that you have, and it works against you constantly. And I say it because it's like we talk about in third person, but it's actually you. And so this kind of starts with having to check in and recognize, how am I thinking? What are the thoughts that I'm having more often than not during the day? And if they're really self-critical a lot of times and very shame-oriented, that's time to reach out for a professional, because it shouldn't be that way. We all make mistakes. We all have bad days. But when you're finding more days than not, you don't see the way to get out of bed, you're not sleeping, you don't feel like exercising, your work doesn't feel productive or meaningful, your family doesn't feel connected, it's time, every day is an opportunity. This is another chance for you to reset and to find your way. You've just gotten a little off path, pull over, take a break, look at the GPS and find your way back to the life that you're meant to have and that you want to have.
Great advice. Are you wearing your Carl's Cause
I
bracelet
am.
today?
I am indeed.
Love it.
Yeah.
Got your green shining.
My fashion point
Yes,
here.
that is that's a great fashion statement. I want to take a live look out at the K today, where next Wednesday night it is Royals for a Cause event. It is Mental Wellness Day at the K. Bob and Kelly, how do days like this, events like this, overall in the community, help people dealing with mental illness? Just, how does it help?
Well, one of the main things, we did this last year as well and had a fabulous turnout, over 500 people in green shirts out there supporting our cause. And it was more of an awareness event, but what interested me a lot was how many people were asking, what is Carl's Cause? Why are you doing what you're doing? And that's one of the big successes of that type of an event. Not so much to raise funds, but to raise awareness. And I felt the magnitude of that was impressive, because of so many people that weren't wearing green shirts wanted to know about Carl's Cause and why we were doing what we were doing. And it was very well received. A lot of people were really, really proud of what we were doing as well as we were. So the event, those types of events, we try to do as much as we can out in public. and get more people aware of why we're doing what we're doing, and maybe we're going to touch a life or two while we're doing it, which we have. We've had people that have come to us and told us what you're doing is saving lives, and actually a few people have told us you saved my life. So we're going to stay after it. We're very committed to what we're doing, and our union with the University of Kansas Health Systems has been immense to help us through our loss.
We love being your partner. Thank you. And thank you for so much that you're doing in our community. How do people come out and take part in this special day at the K?
Well, we have a link on our website for tickets. The Royals have been so great. They have a code where $3, I think, for every ticket goes back to Carl's Cause. So our website is carlscause.org, just CarlsCause.org. And the code is Carl, CARL, 2022 exclamation point. But there's a link to that.
All right. So
Roy, repeat that for you one more time.
Oh, well.
Carl's Cause. Okay, that's fine. Anyway, yeah.
You know what? We're going to put that up.
Okay.
Don't you worry. We will put that up on our feed so that people can know where to go.
Wonderful.
And we'll repeat it. I'll make Greg repeat it here at the end of the show for us. I want to get to some community questions, if we can. Ruth Ellen has a question. How does one distinguish between environmental situations, physical and internal mental stability? So many different variables.
Well, I think it's important to try to get away from the separation of those. The reality is that your environment affects your personal, affects your all of it is intertwined, and so we don't really want to try to get away. For years there was a nature versus nurture, and it's actually both, because your nature impacts your nurture and your nurture impacts your nature. So essentially, what we're looking at here is that it's a global thing, and there's something called the biopsychosocial model that basically says it all matters. And so it's important to recognize that every single bit of your being and everything you do impacts how you feel, how you think, and how you behave. So recognizing that and looking to see what triggers you is a good thing.
All right. Jeannie shared something with us this morning. She's one of our longtime viewers, and she said she lost her son by suicide in 2020, very recently. So Jeannie, I hope you feel surrounded by love and support here this morning, and thank you for sharing that. I know that this is a heartbreaking time for you, but she wants to know, what are your thoughts about mental illness being an incurable disease? Do you feel it is just an incurable disease?
It depends. Certain disorders like schizophrenia, bipolar disorder, and even certainly major depression do respond to medication, but medication compliance can be very challenging, and especially in the bipolar population, because bipolar works as, there's extreme highs known as mania, and then there's extreme lows and crashes known as severe depression. And so the medication looks to basically take those waves and kind of smash them down into a mid-range, so where you never really feel as high and you never also hit those crashes. Mm-hmm. And the important thing is insulation against the crash, but the reason that it's difficult to remain medication compliant is that they miss the highs. It feels great to be manic. It's and that's one that makes it very hard. But the reality is that, some of these are lifelong and pervasive mental illnesses, and they require attention and diligence and responsibility and caring throughout the entire life course.
Yeah, please.
Touch on something real quick. And so, kind of piggybacking off of what Dr. Nawalnik said, medication works along with therapy, and that's essentially the gold standard. And so whenever people take their meds and they start to feel better and think, I don't need these anymore, and I'm finding a lot of that in working with my navigator patients, and just constant reminder of, yes, I understand you don't want to take these medications. However, how did you feel before versus how do you feel now? Well, I don't feel the same now. I just feel more normal. And I'm like, and that it means that you're stabilized. So if you start to miss a dose, or if you start to get off your medications, you will backtrack. And so it's constant support to the patients, and it's constant support to families of reminding to take medications.
Question from, hold on, let me get to it. And I'll ask you this, Dimitri. Isaac wants to know, is the increase in suicides a result of the overall atmosphere of anxiety surrounding COVID? And just for what you saw or what you observed?
I think, and Dr. Nawalna can touch on this too. Like,
I was like, no, good luck. You got this one.
Yeah, thanks. I don't think it helps by any stretch. And as we harbor ourselves or hibernate, that's the word I'm looking for, as we hibernate in with COVID and trying to figure out how to get back into society after being caved in for 3 years, I can imagine that is very stressful. Is it a leading cause? Is it a top cause? That I can't say. However, it doesn't help. Greg, do you have anything?
Well, I mean, the anxiety certainly can produce kind of overwhelming feelings of hopelessness and helplessness, which are two, paramount pieces of suicidal ideation. But the other thing is that the pandemic produced isolation, and we are social animals, and we're also animals and creatures of habit. And so when you completely disrupt someone's habit, and then also, kind of isolate them from their support systems and their coworkers, family, friends, recreational activities, we're going to see an uptick in those hopeless and helpless thoughts. And as this thing shifted from initially, people thought the pandemic, a couple months will be better. As we saw it drone into year and even get, worse as it went on, that had an impact. And I think that like I said earlier, we're going to start to see more of the psychological impacts and effects of that coming out now that we hit this phase of kind of, I don't want to knock on wood, be the guy, but stability. Seeing a number of 3, how exciting is that?
Right.
And also, I know Bob certainly probably recognizes it's interesting that the COVID number is 3 today that they're on, because that was Carl's number. So 3 can always interestingly impacts whenever Carl's cause is involved with anything. 3 or his initials will show up. So
interesting.
Yeah, really something.
Yeah, you have to believe in that higher power on that one. I love it. Angela wants to know, is this hereditary? Are mental health issues something that people need to trace back?
I mean, some certainly are. There's a genetic predisposition sometimes. So if somebody in your family, either side, has never had a psychotic disorder, schizophrenia, and the likelihood that you will develop it outside of a major medical condition or substance abuse is next to nil. But bipolar, schizophrenia, depression, there is a genetic link. It's not like a 1-to-1 correlation, so don't think, my mom had this, I certainly must have this. It doesn't work like that. You have a genetic predisposition, and so that's where awareness and maybe proactive mental health care, to where you're staying ahead and checking in with a professional, would really help you to detect that earlier. And the sooner, we know that the sooner that we can intervene, the more productive that the treatment can be. And I'm glad Dimitri pointed out, medication isn't everything. It's medication hand in hand with quality therapy.
Yep.
And on top of that, Christy wants to know, she has this comment and question, and you already mentioned it today about exercise, but since research shows that an hour a day of moderate or high level intensity exercise is very effective treating mental illness, why isn't it discussed or prescribed more? I know that's something you do prescribe and you do advocate, you talk about that all the time, but maybe they're not hearing it. Maybe we talk about medication a lot and it's not, kind of like this, kind of being your own self-advocate. What can I do? What can I control? What advice do you give to people? And how important is that?
Well, I think, when we go to a medical professional, as Americans, we're kind of conditioned to look for the pill. What do I take? What's going to fix this? And I think that we have a difficult time accepting that we have the power within ourselves to at least to hedge our bets substantially in terms of a healthy diet, regular exercise, good sleep. That's number one. That's so important. And then obviously staying active and getting outdoors. So, Dimitri, you have anything else on that?
I mean, Dr. Rolnick pretty much hit it on the head, and it's about routine, and routine really helps. We're creatures of habit, and so if we get outside of our routine, and if we get outside of what's not normal to us, it's going to throw us off.
Makes sense. And that's just like one thing you can do. It's like making your bed. Just get up and just be active in some way or another, right?
And also, it's an early detection sign. Is when you start noticing you're not enjoying or not doing things that you used to love and enjoy, that's a warning sign.
Yeah.
That should be like the glaring thing on your dashboard saying like, hey, this thing's about to blow, like you better
Right.
pull over. And so we have to be willing to stay in touch with ourselves and check in. And when we look at the pandemic, a lot of the impact that we're seeing is that it did produce that variance from baseline. And our brain is extraordinarily complex, but it works by pairing things and trying to keep us safe. And so when it sees us not able to enjoy things that we did, it starts to produce feelings of depression because it's like, oh, something must be really dreadfully wrong. And it's trying to make sure we're aware and do something about it. But if nothing's done about it, it just continues to get worse.
You're the one who always talks about it being like, the check engine light comes on in our car, and
I'm that guy. Yeah.
and I would say we all rush and get our car taken care of. Of course, I don't, but I'm saying, you say, think of it the way we look at it. We're constantly keeping a check on this and that, and making sure these gauges are online, this temperature's right, and everything's trucking down the road. And we need to look at ourselves the same way, right?
Well, yeah, whenever you walk past the cockpit when you're getting in an airplane, how many gauges and bells and whistles are up there to try to keep the plane in the air?
Yeah.
We're the same. We have all different things to alert us. And, depression and anxiety are our body's two best tools because they get right in the way and they will let you know, hey, we're down here. Something's not right. Like, check it out. Look what's going on. And unfortunately, where cars, they put the light out there and you have to take it to the dealership unless you've got the YouTube video that shows you how to hotwire it and like get under there and be like, no, push and reset.
Right.
We can just easily ignore it, but it does keep showing up again. And the more, I've said this since the beginning of the pandemic, but what we resist persists. And so the more that we try to stuff these feelings down and just ignore them and go on business as usual, la, 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 it's going to come out in other ways. And sometimes we see that in uptick in substance abuse. We see that in being a little snarkier and snippier. We see more arguments. We see more isolation, more distance. These are all things that if you're experiencing any of them, these are the check engine lights on your dashboard. And it's time to check it out. Get in, take it in the shop.
And as Dr. Nawalnik is talking about all these symptoms and what to look for, my thought is what I would like to relay to everyone today is, where do I find these resources? Okay, I'm being told to look. There's the local community mental health centers in the county that you live in if you don't have insurance. Or if you do have insurance, call and see if you can get into a provider if possible. And so that's just something I just wanted to briefly touch on. There's NAMI, and then there is crisis lines, suicide hotlines. Missouri has their own hotline. The state of Kansas has their own hotline. So we have information that I would be happy to share. We can get out to people.
Thank you for adding that. I want to get to some final thoughts, and I want to start with Bob and Kelly, and again, just thanking them for being with us, sharing your son with us. He lives on through the work that he continues to do. His name, and I do have to say, I met you all over 3 years ago, Kelly, when I came out to your house to do that story, and then just a couple weeks ago, I run into Dr. Nawalnik, and he comes to my office and he said, "Oh, you've got to meet the Spechts." I said, "Well, I've already met them." He's like, "They're so great." And then one of my journalist friends who works for one of the TV stations, who I know so it's like, I don't know, 6 degrees to the Specs here in Kansas City. So I just want to let you know that the work you're doing matters. It's being seen and it's being heard. Carl's name is being heard, and I just wanted to make sure you know that. And so thank you so much for all you're doing. I'm going to put, we have carlscause.org up on our screen right now. So that'll sit there while you two give us some final thoughts for our day. And what do you want us to know?
Well, first, number one, thank you for this time this morning. Honestly, this has been great. And we are just very proud of our relationship with University of Kansas Health System. The reason why we partnered with them is because of what they are doing for behavioral health. When Carl was struggling, the hardest part was we had barriers to care. And when we found out what KU was doing with Strawberry Hill and the commitment they've made in our community, we thought that's who we want to partner with. Because we're not professionals. We never, we want to defer to them, but the people that are making the difference. And to have been able to hire Dimitri, to raise enough money to support that position has just been we're very proud of that. And we couldn't say enough about University of Kansas Health System and what they are doing.
Thank you, Bob. Bob, go ahead, please.
No, I agree totally with what Kelly said. I thank you because this platform, this format is what's going to make a difference. happens. The more we're able to be out and talk to people and hear, professionals talk about it, people will understand that there is help. If we'd have had this with Carl, I believe Kelly and I have talked about it. He would be here today probably. We'd have got him through it, and so we're so proud to be part of this group that's helping people, and we're going to stay the course.
Thank you again so much. You're welcome back anytime to talk about this really important topic and to share Carl's story. Thank you.
Thank you.
Dimitri, you are living, breathing example of what Carl's Cause has produced, and here you are sharing and helping more people. So just your final thoughts today.
Working with Bob and Kelly and being part of the Specht family has been amazing, because you are absolutely correct. Everyone knows the Spechts or has heard of the Spechts and knows the story. And so the fact that I was handed this opportunity from whatever power you believe in, and to build this program and to touch lives and to provide resources and to help people get through their darkest days has been such a overwhelming, rewarding opportunity for me. And the ability to expand our services, because the need is so great, especially now that we are talking about hiring a Miralac navigator, raising funding for that. The need is there. It's at Strawberry Hill, it's at main campus, it's in our psychiatric liaison services. It has been such a huge eye-opener to be able to help people, and that's what I'm here for. That's what I do, and so I'm very grateful for the Spechts. The situation is heartbreaking, but it just shows their resilience and how strong that they are to put this and use this as their gas in the vehicle to help save others' lives, essentially.
Dr. Nawalnik, final thoughts today.
It's a heavy talk. It's an important talk, and I think that the work that Carl's Cause does in terms of raising awareness is so invaluable. I mean, you can't put a measure on that. And the creation of the Navigator, how many lives that Dimitri has crossed, and sometimes you look at the butterfly effect. It's like just one subtle nudge along the way can make a huge difference and impact in someone's life. But I guess the final thought that I have really is that every one of you out there matters. Your family members matter. You are important. You are special. You have gifts. And sometimes, whether it's a pandemic, whether it's substance abuse, whether it's our job, our struggles, financial issues, these are temporary things that get in the way and can make it seem like there's no way out. There's always a way out, and it's up to you. This is what's hard, is that it's up to you to be the one who says, I'm done with these thoughts. I'm done with this. I recognize here's the point where my life was where I loved it, and this is where I was happy. Something's gone wrong, and I need to work with someone to go back and figure out, how can I pick up these pieces? How can I get back to the path that I'm meant to be on? And what are the questions I need to ask? Whose voice is that inside of me that's telling me the critical things and helping me to blind myself to the possibility and the positives in my life? So I encourage you all to take that journey and take that first step and find your way to help, because that's why we're here. We're so grateful every time that we see someone in a session and just see the light kind of come back. It's what we do. It's a gift like none other, but it's a gift that you ultimately have to give to yourself. We can't go in your home and find you. You've got to come out and find the help. So please do that. Thank you for that.
Thank you for you, Dr. Hawkins. And I know I had some COVID questions come in for you today, but I'm going to hold until tomorrow, because we just had this really important topic that we wanted to make sure we gave a lot of time and energy to. But I do want to hear your final thoughts.
No, I think we need to be continued focus on this topic, just like Dimitri and Dr. Nawalnik said. Really nothing more to add other than just how vitally important this issue is for that person going through it and for their loved ones and their families. So, just like the butterfly effect, like Dr. Nawalnik talked about, just a little nudge. Just take that first step. There are resources out there. Sometimes you have to try to find them, but there are resources. Please take that first step.
Thank you. to everyone this morning. We appreciate you. Well, in headlines this morning, Popeye, well, he was on to something. New research finds eating spinach and leafy greens can lower your risk of dementia. It's all thanks to the high antioxidant levels in those veggies. So we spoke with Dr. Jessica Calendar-Rich, medical director, post-acute continuum of care here at the health system, about the latest study.
We know that a healthy lifestyle is the best thing that we can possibly do for our cognitive health and to prevent dementia as we age. And that includes eating things like spinach and leafy green vegetables and fruits, and also getting exercise. And those are the best ways that we can really protect ourselves and our brains as we get older. So creativity is really key to ensure that we're getting all of the different colors of vegetables into our plate. Making sure that things look nice can be really helpful. But also really exploring some of the vegetables. Many of our older populations didn't have the same exposures to things like even kale or sushi or a lot of the things that people now are more commonly eating. And so really just opening up the door to bringing in new tastes along with the old tastes can really expand that palate. We think that in the same way that they help protect our hearts and other parts of our body, that they really decrease that inflammation, while also supplying us with a lot of nutrients that our bodies need to build cells and regenerate the things that may be changing with age.
Nothing's changed. Eat your veggies, eat your greens. Nurses are heroes, and that has never been more apparent than over the past couple of years. This week is National Nurses Week, and while 1 week is certainly not enough to truly recognize the impact nurses have on all of our lives, this week we share our appreciation and our gratitude for all they do. And we ask some of you why nurses mean so much.
I have a lot of respect for all of my colleagues, especially getting through the last 2 years and just seeing how resilient we are as a profession. I wouldn't change my profession for anything, so.
And finally, this morning, taking steps to help those with mental illness. More than 130 employees from here at the University of Kansas Health System took part in this year's NAMI Johnson County Walk. It happened this past Saturday at Sarco Trails in Lenexa. The event helps raise awareness for mental health challenges in an atmosphere of hope and honor. Several mental health organizations were also there so people could get as much information as possible. It's not just talking about it, it's making sure people know where to go. The event raised more than $47,000 for mental health services. Well, thank you so much for being with us today and talking about this really important topic. Do not forget, you can catch our shows anytime by logging on to Facebook, Twitter, and also on YouTube. Everyone, have a great Tuesday. We'll see you back here tomorrow. If you're having trouble breathing, you're not alone. This Wednesday on Open Mics with Dr. Stites, the study helping expand our lung capacity and how you can take part. We'll see you at 8 on these social media channels.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.